Hello and welcome to this CPD module on using smart recalls to improve care plans and health assessments in general practice. My name is Magali De Castro and I am the Clinical Director here at HotDoc. This module has been developed to provide both a walkthrough of the smart recalls technology in action and some helpful strategies and tips to help care planning and health promotion efforts in your practice. So this session is for you if you're currently using smart recalls and want to learn how to use it to boost your care planning efforts, or if you're considering smart recalls and want to learn more about how it works, or perhaps you want to stay up to date with the tools and technology practices are using across Australia, or simply you might be looking to pick up some tips and strategies to improve your recall and reminder process. So whatever the reason, you should still get a lot of value from this session. Here's what we'll cover in more detail. We'll start with an overview of the smart recalls technology and how it can benefit a practice. We'll then look at how to use it to improve care plans and health assessments, including how it helps to overcome common barriers to successful plans and assessments in practice. We'll discuss effective tools and strategies to recruit patients for these initiatives. We'll look at tips to better engage patients in their care, and we'll also cover key aspects of organizing your practice for effective workflow. Please note that when we talk about care plans in this module, we're referring to the Medicare-funded GP management plans, or GPMPs, and team care arrangements, or TCAs, items 721 and 723. And when we talk about care plan reviews, we're referring to item 732. There's a detailed session on how these items work as part of the HotDoc CPD module, Proactive Management of Diabetes. You will find the link to that module in the resources section of this course. When we talk about health assessments, we're referring to initiatives such as the 45 to 49 health check, the type 2 diabetes risk check, and the over 75 health assessment. There are other health assessments, as you know, and these all correspond to items 701, 703, 705, 707, or 715 for patients of Aboriginal or Torres Strait Islander background. Let's start with a quick overview of smart recalls. The smart recalls technology was developed by HotDoc, working closely with general practices to improve the way recalls and reminders are run. Recall and reminder processes can vary considerably from practice to practice, but regardless of how clinics run their system, there seems to be general consensus that the process is hardly efficient. The status of a notification can be difficult to track, it's a time-consuming activity for practice staff, and the regular mail-out costs can quickly creep up to become a considerable burden for a practice. So let's take a look at the key considerations when looking to improve your recall and reminder process. The first and probably most important consideration is that your system remains compliant with RSCGP standards for general practice. Of particular importance is the use of a 3-point identity verification process to ensure that you're reaching the right patient and that you're not breaching privacy and confidentiality by disclosing health information to unauthorized parties. Some clinics have opted to manually send SMSs to notify patients for recalls and reminders, but please note that if your system doesn't have a 3-point identity verification, then you should not include any health information as part of the SMS. It should be generic in nature and only prompt the patient to call the practice for more details. By disclosing any health information in an SMS, you're at risk of potentially breaching patient privacy and confidentiality, which could lead to litigation. With this in mind, Smart Recalls was developed with an integrated 3-point identity verification, which patients complete before any health information is revealed. It's what we call an SMN, or Secure Mobile Notification. I'll cover this process in more detail later in this module. A good recall and reminder system should also save staff time and reduce costs. Every time there's a layer of manual paperwork processing, we waste staff time that could be better spent looking after patients directly. We also increase the probability of making a mistake and losing patients through the recall system gaps. Your system should also be audit safe. This means you must be able to demonstrate documentation of notification attempts and have a way to track how successful these notifications were in resulting in an appointment being booked. Finally, the uptake of appointments must be better with the improved system than with the legacy approach of sending patient letters. So this is how Smart Recalls was born. So how does it work? Smart Recalls automatically detects all recall and reminders from the clinical software. At the moment, it is compatible with ZMed, Best Practice, and Medical Director. Then, based on the practice preferences, Smart Recalls sends a notification securely to the patient's mobile using a 3-point identity verification process and providing the practice with real-time tracking of whether the notification has been received, if it's been read, and even if an appointment has been booked. This is the process from the patient's point of view. First, the patient receives an SMS with only generic information. Remember that no health information should be revealed on an SMS. So this message contains the practice name and phone number and a secure link that is unique to that patient. When the patient clicks on their secure link, they're taken to their details verification page. Once they confirm their surname and date of birth, they're able to securely see their full recall notification. These notifications are beautifully presented in patient-friendly templates that can be fully customized for each different recall reason. The Smart Recalls template library comes preloaded with patient-tested recall notifications, with language that is jargon-free and that highlights the benefits and importance of that particular service. This results in patients that are more engaged, better informed, and more motivated to book an appointment. Smart Recalls allows you to create new templates or copy content from letters that you may already be using with your patients. Because each recall reason can have its own template, you can include special instructions for certain recalls, such as to book an appointment with a nurse instead, or to remember to bring x-rays or copies of reports or whatever is applicable. Patients also have the option of booking an appointment immediately online or by calling the practice directly from the recall notification. Every practice using Smart Recalls has access to their unique practice dashboard, and from this dashboard you can track results of recall notifications. You can see how many contact attempts have been made, whether the patient has received the message, read the notice, and even if they've booked an upcoming appointment. All progress is automatically updated within the patient file for easy clinical reference and for audit purposes. So there is an entry in the patient file. Some of the benefits of having Smart Recalls include saving a considerable amount of staff time, since once the practice settings are in place, all recall reasons are assigned to their desired template, and these notifications go out automatically every day. You can track recall status like never before. The cost of a smart notification is a fraction of the cost of a stamp, and that's before taking any paper, printing, folding, or mailing time into consideration. And finally, for those notifications that can't be sent by mobile phone, either because the patient doesn't have a mobile or is elderly, or they opt out of mobile notifications, then Smart Recalls allows you to centrally manage the mail merges for any remaining notices, each with their own template as well. There's a few more great features, but we'll cover those later in the module when we're seeing them in action. Can Smart Recalls really help improve care plans and health assessments? Most definitely. And to show you how, I think it's important to first take a quick step back to understand why most practices struggle with care plans and health assessments. So what are the barriers we find time and time again? Well, I've been performing, teaching, and setting up management plans and health assessments in clinics for nearly 10 years. And no matter where I go, the barriers are pretty consistent and unfortunately quite persistent. This may be your experience as well. Some of the issues we commonly see in practices that struggle to implement these initiatives consistently include conflicting information from different sources and people in the practice as to what's really required to claim these items. Lack of consistent processes across the practice, so all GPs, nurses, and admin staff know what's happening and can clearly communicate to patients what to expect. Finding it difficult to get patients to come back in if they don't feel there's anything in it for them, or when patients do come in, it's only because they want their referrals or for their allied health sessions. But it's very difficult to get them to come back in for reviews. Finally, many practices report concerns that maybe the entire process is just a money-making scheme and there's no real value to patients beyond their subsidized sessions. Now, there's reasons why there's all these barriers, and they are real, and many practices do struggle with them every day. But simply because care plans and health assessments can present a few challenges doesn't mean we can't find ways to make them work. So let's break these barriers down one at a time, starting with recruitment. How do we attract patients and invite them to participate in these initiatives? When I talk about recruitment, I'm referring to the process we use in the practice to get patients on board with the initiative, be it care plans or health assessments. But I'm also referring to the process we use to get the practice team on board. How does your practice go about making sure everyone in the team, from reception staff to the nurses to every single GP, clearly understands what we're trying to achieve? What the initiative is for, its purpose, the value and benefit to both patients and practice. To complement this training, we've put together an essential promotion toolkit, which includes a practice poster and a patient fact sheet to help communicate both internally and externally the purpose and value of these activities. It's important to discuss these resources as part of a staff meeting and ensure the team gets a chance to maybe go over what are some of the issues, what's not currently working well, and set some goals of improvements to start testing, and also make sure that you set a new meeting date where progress can be reviewed. This is similar to a plan, do, study, act cycle, commonly used for quality improvement activities in general practice, and is also the framework frequently used by practices participating in the primary care collaboratives, which you may have heard of. So how can Smart Recalls assist with patient recruitment? Well, as soon as we identify eligible patients, which could be done opportunistically or systematically by screening the patient database, and I'll cover this in a bit more detail later, we would enter a recall or reminder reason for either a new care plan or a review of a plan, or if the patient is eligible, for a health assessment. Each one of these reasons would be allocated to their corresponding recall template in the Smart Recalls library. And to demonstrate this, here's a demo of the process within the Smart Recalls dashboard. First, we would allocate a template for the recall reason. That's in case one hasn't already been allocated. We only need to do this process once, and the Smart Recall system learns our preference of what we want it to do every time that same recall reason comes up for any patient. We click on the patient to allocate a template. We either create a new template, or we can use or customize a template based on one of the supplied samples. Modify any text as desired. Include any special instructions, such as ensure you book an appointment with a nurse, or a reminder to bring details of any allied health providers or specialists they currently see, which can save you a lot of time in the event that you do need to coordinate a team care arrangement or TCA. And next, you can decide if you want them to be able to book online for this appointment type, or if you prefer that they call the clinic to make this type of booking. For time-sensitive items, such as care plans, reviews, and some of the health assessments, we recommend you select the option, delay sending until due date. This prevents the notifications from going out too soon. Usually notifications are sent 2 weeks before the recall date is due. And by using this delay until day due, it prevents patients from booking too early and triggering a Medicare claim rejection. You may have noticed that you also have the option to send this message as a mobile notification by default or as a letter. Most practices will allocate the majority of notifications to be sent by a mobile, with only a few notifications being allocated to default to letter. An example could be if your practice would regularly send pathology request forms along with routine blood test due notices. It is recommended that for most recall types, you should attempt to send by a mobile first. Afterwards, the system will automatically prompt you anyways and allow you to send a letter if the patient hasn't engaged with the mobile notification cycle. You only need to set these preferences once, and the system will remember for all future recalls of the same type. So how does using Smart Recalls help? Well, it's a fantastic tool to easily and quickly set up proactive communications with patients. Because the templates are specific to each recall type, they're able to be truly targeted and highlight the value and importance of that particular service in language and terms your patients will relate to. You can configure the mobile notifications to only go out once, or to make up to 3 different attempts, each one a week apart, and to then prompt the staff in charge of recalls if there's been no response, so that either a letter or phone call can be made if you wish to chase up or follow up those patients a final time. The system allows you to select which reasons will be sent by a mobile and helps you centrally manage any reasons or individual patients who will be notified by a letter. You can quickly check at a glance if the patient is already booked in for an upcoming appointment. It's easy to see how all these features work together to help with patient recruitment for care plans, reviews, and health assessments, and how powerful Smart Recalls can be to help with this process. Next, we'll take a look at patient engagement and how Smart Recalls can help us bring patients back into the practice for activities like reviews or follow-up care. Let's take a look at how Smart Recalls can help improve patient engagement. Once we have the patient in the practice, the challenge can be to get them to return for services like care plan reviews or health promotion activities like health assessments. A big reason why this can be such a struggle is because we haven't strongly established the value or benefit of this service in the patient's mind and in a way that resonates with them. So how do we achieve this? First, we need to clearly articulate the purpose of creating a management plan or the value of having a health assessment. And a handy tip borrowed from health coaching practices is to ask the patient to tell you how they think this process might be of benefit. After all, if it comes from them, they will likely value it more. There is a saying that goes, you'll believe 50% of what I tell you, but 100% of what you tell me. So if you're engaging your patients to tell you and buy in on how this process is beneficial, you're already likely ahead of 90% of practices performing these same services across Australia who are beating their head against the proverbial wall, trying to get their patients to listen. Get the patient to identify their main area of interest or concern and incorporate this as part of the plan or the assessment. A common question I ask my patients is, what do you feel is affecting your health the most at the moment? Or alternatively, I may ask, what do you feel would improve your health the most? A patient who identifies their diet could do with some attention, or that they would really like to become more physically active, but they don't really know how, is much more likely to be open to the idea of a referral to a dietitian or to an exercise physiologist. It's also important to reinforce key messages with written information. To assist with this, we have included a patient fact sheet that explains how the allied health sessions work under Medicare funding. This is one of the resources within the Essential Promotions Toolkit. Set up the purpose and value of a follow-up session to review progress and get the patient's agreement to attend for such a session. A sentence I might use for this would be something along the lines of, hey, it would be great if we can see how you're going with these changes in 3 months' time. I can set up a reminder in our system to contact you closer to the date so that you can come in for a review session. Would that be all right with you? What this accomplishes is a couple of things. First, it gives the patients a clear time frame within which they can implement changes that will have a positive impact on their health. Also, they now have a reason to feel accountable for their actions. And I actually have seen this motivate patients with actual evidence increasingly suggesting that having that kind of support can make the greatest difference, especially when it comes to lifestyle changes. It also means that when we add that recall and the time comes around for the smart recall notification to automatically be sent to that patient, your patient is now expecting this and will be much more likely to engage and book an appointment. You can even create new recall reasons and templates to support milestones of reviews of lifestyle changes in between formal management plan reviews or health assessments. For these encounters, nurses could use item 10997 to support patients with management plans, or patients could be seen under standard consultation items. This means you may decide to implement an interim review, for example, in 4 weeks' time to check on progress with, say, changes to their diet, or you could implement a 3-month review to complete components of their cycle of care if they're a diabetic. Another practice tip some clinics use with care plans is to spread out their referrals across the year to provide more incentive to patients to return for their referral paperwork and to actually access their additional sessions. This can be an effective strategy, but be mindful that it may not be suitable for all patients, as some will require to see their allied health provider in a fairly short amount of time for optimal health outcomes. So use it with clinical discretion. In the next and final section, we discuss considerations surrounding practice workflow. Now we'll take a closer look at practice workflow. All practices work in slightly different ways, so it's important to find a setup that suits the needs of your practice team and that aligns well with your existing processes. So far, we have discussed some of the key components of a successful care planning or health assessment process in practice. We've discussed strategies to help us recruit patients, and we have looked at ways to engage patients better during the consultation and also ways to motivate them to return to the practice. It's also important to reflect on how well the practice is managing the multiple contact points a patient has with the team as part of a care plan or health assessment process. Good communication both within and outside the practice is paramount in order to ensure patients and also external providers get a consistent message across members of the practice team. Here are some tips and workflow considerations that may benefit your practice. Think of these as ideas you can take back and discuss with your team. The first consideration is to decide on your preferred approach. Is your practice going to be reactive or proactive? A reactive approach means your practice would prefer to wait for patients to request plans, or may also include opportunistically offering plans and assessments when the patient attends the clinic for any other reason. Please note that if you will be offering services opportunistically to patients, you need to always ensure that the patient considers your practice as their usual GP. This is because care planning and health assessment items should only be claimed by the usual GP or usual practice, meaning you have either provided the majority of the services over the past 12 months or you will be providing the majority of the services over the coming 12 months. If the patient considers a different clinic their usual GP, and the only reason they come in to see you is for a one-off service, such as a sick certificate or an acute issue where they were not able to book an appointment in time with their usual practice, then you should not perform either a management plan or a health assessment under Medicare for this patient. The proactive or planned approach, on the other hand, will focus on routinely screening the patient database to identify eligible patients and invite them to participate in these initiatives. This doesn't mean you wouldn't also opportunistically invite patients if they happen to attend for other reasons, but it means your overall approach would be one of actively approaching patients before they are booked to attend the practice for other reasons. There are multiple ways of screening the database for eligible patients, such as either using your search functionality within your clinical software or using clinical audit tools. If your practice is using HotDoc Smart Recalls, you can book a support session where I can help and support you through this process. Once we have identified eligible patients, we would ensure the right recall and reminders are in place in the clinical system so that it can be picked up automatically by Smart Recalls and so that secure notifications can be sent when the recalls become due. Another good idea is to get clarity and a practice consensus around the role different members of the practice team will play when it comes to care planning and health assessment processes. For example, the role of the GP will always include a personal attendance with the patient to ensure that the GP is happy with the suggested interventions and also to put in place any referrals or requests for investigations. Practice nurses could assist with activities such as screening the database, adding recalls in the clinical software, assisting with recruitment of patients, and helping to explain or answer questions about the initiative. They can also help collect information, assess patient needs, discuss health goals, possible referrals, coordinate care and communication with external providers, and even be the lead coordinator of the overall care planning or health assessment process in the practice. Administrative staff can assist with elements of patient recruitment, answering patient questions, and ensuring bookings are made correctly for the right length of time and with the right providers. Some clinics may prefer patients book for an appointment with the nurse first for some of these items, which is then followed up with a consult with the GP immediately after. Now, this may actually happen on the same day, which is the ideal, or it may take place over different days if the nurse and GP work on different days. If this is the case, it's going to require patients to be informed in advance so that you can prevent any frustrations or misunderstandings. Administrative staff can also assist with promotion of these initiatives by setting up patient posters and fact sheets. Remember that we've actually already provided some of these for your convenience. And they can also help with sending or tracking correspondence, particularly with external providers. In many clinics, it will actually be the practice manager who's in charge of the recall and reminder process. Smart Recalls dashboard makes it easy to track the status of all these notifications as well as manage any remaining mail merges centrally. That brings us to the end of this CPD module where we have learned how to use Smart Recalls to boost care planning and health assessments in the practice.